next guest. We have directly from Philadelphia today, Kristina Pumphrey, who is the Director of Process Engineering at Proqis Engineering. Kristina, great to have you with you. A bit more on Kristina. She is a professional chemical engineer and Director of Process Engineering at Proqis Engineering. She has over 20 years of experience assisting companies design manufacturing facilities in the pharmaceutical industry. As a certified Lean Six Sigma Black Belt, Kristina uses her lean manufacturing expertise to help clients plan for the future by improving operational efficiency. We're honored to have you. Very much looking forward to your presentation.
Thanks for having me. I look forward to it as well. So I'm going to share my screen and we're going to get started. So welcome everyone. Today I'm going to be talking about leveraging process mining to design for success. And really what it is to talk about how to use strategic facility planning and capacity planning and leveraging Lean Six Sigma to do that and the data behind it. So regulated industries like the pharmaceutical industry inherently collect a lot of data. Today I'm going to discuss the type of data that is being collected and how to leverage it to not only work more efficiently in your manufacturing facility, but also how to use it to plan for the future. As you can see from the agenda, we will walk through a strategic planning approach and examples on how to use Lean Six Sigma tools and techniques to scope capital projects and use the analysis as part of the business case for the project using cost justification. Just a caveat, I'm no expert on the technology side of data collection and process mining. I would look to some of our other experts speaking at the conference to talk about how to interpret that, how to collect that data and be able to interpret it through programming and the computer system. Talking a little bit about what the data that is already being collected. One of those is process parameters. Those are easy to leverage because they're being collected separately through I/O, and usually alarming when your pressure and temperature and other parameters are trending out of spec. But there's a lot of information collected in the batch records and other areas. If the batch records are set up electronically, the inserted data can be pulled automatically, but there's still a lot of facilities still using paper records, and that data isn't getting entered electronically anywhere. Data in batch records like cycle times, raw material, actual quantities, yield, and deviations are things that you can find within those batch records. Some other data to think about collecting is the operator. That's usually found by their login, and cumulative throughput and rejects are also very good information to be collecting. Collected data doesn't really help much. What is really needed is the interpretation of that data. It needs to be, you need that download the data into a format that can be easily analyzed. Best is if there's a program that does it for you, but it can also be as simple as an Excel file that does the interpretation from the downloaded raw data. We all know that if it isn't easy, it won't get done. Here are some examples of interpreting the data. First is the control chart, which plots the operating points within the control boundaries. This is good to see trends and when approaching the control limits. This can help predict deviations, but I've also seen it to be beneficial for preventative maintenance, especially when talking about things like rotational devices. You can predict failures, but it can also be used to extend preventive maintenance durations. If you aren't approaching the control limits, you may be able to go another 6 to 12 months longer until you need service. And this can save a lot on operational expenses. The next example is plotting cycle time curves, which is your standard deviation and against your cycle time and your frequency. It helps to identify which steps have a lot of variation and would be improved by a standard work exercise to shorten the cycle time. If you can go from a more flattened curve to a lower standard deviation, you know that you have a much more reliable process with most likely shorter cycle times. Now I'm going to talk a little bit about strategic planning. It really is worth the effort to spend a little bit of time strategically planning for the future. The first step is to do a capacity analysis and have an understanding of what you are currently making by tracking throughput. And more importantly, you want to know what is the maximum throughput you can make in your facility. Then, when you compare it against market forecasts, you can identify where the gaps are to meet the demand. From the gaps, that helps to develop a list of and scope for capital projects. Sounds pretty easy, right? Well, the final presentation to management should look that way, but there's a lot of data and analysis that is needed to go into that presentation. I'm going to take you through some tools and examples to show this approach. You can use collected data to track actual throughput, which is this black line, but you also want to know what the max number of batches are. So if we just take a second to look at what this table is here, what you're looking is at a demand chart that looks at your current demand versus your forecasted demand. It goes against doses is what we're looking at on the left side. In this particular case, we're talking about vials. And also we're looking at it against the year of the projected demand. The different colors that you see in the bar graph really represent the different products of this facility. So as I said, the black line is showing what the actual demand is per year that's being done. And you also need to know the maximum capacity. What we're looking at here is they were fine up until 2016, but in this specific case, there was a large demand between 2016 and 2017. There wasn't enough time to really get a new fill line. That would take a couple years. So they had to do something to be able to increase capacity. Therefore, operational efficiencies had to be done to get more throughput. The easiest is adding additional shifts. The third shift and the even Saturdays can make a large impact. But you should also realize that with a 24/7 operation, you're losing time for maintenance and makeup time if you're behind. Some other options that you have in increasing throughput is adding equipment, but this is usually a long-term solution. You may be able to find some items that can be added and increase throughput within the next year, but a lot of this require planning and a capital a capital project. Finding ways to reduce cycle time and improve efficiencies can also add to your capacity. Support areas are usually where you see the most gain, and we'll go into a few examples later. As you can see from here, doing some of these operational efficiency improvements, we're able to let them squeak out more capacity in 2017. But it certainly isn't going to be enough to meet the forecasted demand for 2018, and that's going to require a capital project. I believe a lot of this audience has an OpEx background, so I probably don't need to tell you to leverage operator experience, but it's worth pointing out. They know where the issues lie and a lot of the time how to solve them. They just need the time, money, and motivation to get it done. And in my experience, someone who can listen and get the solution to the right person. Often summarizing the information and illustrating this way really helps to get everyone's attention, because you can see a lot in just one vision, and you know that there's no way you're going to be able to make it from here to here without doing something. During the capacity analysis, you usually engage the design team to start concept design. The team helps to identify the gaps involved with expanding capacity, especially on the facility side. What we're talking about is looking at the facility layout, your gaps in your utilities, and other things on the design side, along with the gaps identified during the capacity analysis. And for anyone that works with forecasted demands, you know that they changed yesterday. It's never always staying the same, and usually you get a new one within every quarter that changes everything. So it's really important to understand how they will change and the level of risk. For example, maybe syringes, you may have products in syringes and products in vials, which require different types of filling lines. There's even new products in the pipeline. And you really want to understand how these risks and these changes are going to impact your assumptions for your capital projects. Usually what I hear from my clients are, I want a flexible design, which could be anything under the sun. So it's really important to add some boundaries around that flexibility that helps meet the objectives and focus the design and the cost. So now there's a long list of wants and needs. It helps to rank the items on impact and effort to help narrow down the gaps and options. It also helps to look at the items objectively. To close out the effort, you might want to limit options, at most 2, maybe 3, and develop your project costs and your schedule. This is also accompanied by a basis of design, which really outlines the different options and supports the project scope to support the cost estimate and the schedule. And ultimately, you wanted to make a recommendation based on the information at the time. Now that I've taken you through the approach, I'm going to show some examples on how to evaluate and incorporate those operational efficiencies, which I'm going to identify as improvements. You really want to, right now you have a list of you should have a list of potential improvements by area, and they should be ranked by short, medium, and long term. As we discussed in the previous slide, ranking the improvements by impact, which is things like throughput and staffing, versus effort, and at this stage, that's usually cost and schedule. It helps to give you a more objective look at which improvements to include. It's also important to make sure you evaluate the combined improvements. One improvement may have a negative effect on another. A good example of that is if you were increasing your batch size. This helps to reduce quality tasks and cleaning tasks that are set up on a per batch basis, but there's more time spent probably picking and kitting and raw materials and components, and that may increase staffing requirements in the warehouse, which was reduced by another improvement. This gives you a good way to look at identifying improvements. Usually if you have a continuous or OpEx department, there's some effort of process mapping where you identify value-added activities, which is really the core process, the things that are added to the product that add value to the product, versus non-value activities, which is kind of an idealist view, which we consider wasted effort. In the pharma industry, there's a lot of necessary waste. things like cleaning and quality testing, that doesn't really add value to the product, but it can't be eliminated and is required in manufacturing. But in my experience, you can make the most impact on the non-value activities. We focus so much attention on the core processes that usually these areas are already inherently efficient. By reducing those core processes, you're really looking at what the traditional approach is. You really only see a small impact in cycle times. But if you can focus on more of the non-value wasted activities and reduce the cycle times there, you can really have a large impact on the overall throughput and capacity of your facility. To evaluate impacts, it helps to use a prioritization chart to objectively look at the different improvements. You quantify the improvements based on impact, which we've said is things like throughput and staffing, and effort, which is cost and schedule. And when you look at schedule, you really want to include the full schedule. In pharma and regulatory environments, regulatory and FDA review is sometimes part of that schedule, which can increase a lot of time into your schedule. Once it's ranked, it falls into the following quadrants. If it has a low impact but a low effort, we call that fill-in or low-hanging fruit. This can be done quickly and it can show improvements fast. Now, if we have a low impact, a low effort, but a high impact, this is considered a quick win. I mean, it's going to provide a lot of benefit and not a lot of effort. So this should be done and started as soon as possible. In the next quadrant over here means you have high impact, but it's also high effort. We call this a major project, but it's usually worth the effort. The quadrant that you really want to avoid is right here, where it's a low impact, but a high effort. This is a thankless task. Over here, I'm going to show you a few examples that fall into these quadrants. So the first one is spare parts and cleaning. In this example, this was for a filling line. And after you're done filling, you usually have to pull out pieces and clean them out of place, usually in a washer, and also sterilize them in an autoclave. If you can have a set of spare parts that have already been cleaned and sterilized, when you finish your operations, you can take those pieces out and replace them with the clean and sterilized pieces, eliminating that portion of time waiting for it to be cleaned and steamed out of place. We put specific requirements or impact, specific metrics on the impact. And what we saw here was that it would have a reduction of 2 hours in the cycle time, and it really did a good job of eliminating Saturday overtime. The impact was only valued at about, this gave us it was a small impact, but the effort really wasn't too bad either. It was only going to cost about $35,000 and it would take 4 weeks to install. So this fell within the quick wins category of the prioritization chart. The next example is visual inspection machines. So with this, it was a very manual process where personnel and operators were reviewing the labels manually. Once we evaluated the impact of adding visual inspection machines, which would add that as an automated approach. The impact of that was a reduction of 6 hours of cycle time, which added an additional 2 batches, and we also saw some staff reduction due to it being more of an automated task. This effort landed us here in that it was $100,000 in cost and was going to take about 20 weeks. So it was going to be a pretty large effort, but we also evaluated it as to be as a very high impact as well. I talked a little bit about what happens when you increase batch size. This eliminates some of those per batch tasks. So you have less kitting, less setup and cleaning times that you see as well. We evaluated this impact to be an additional 8 batches per year. And it would only take about 12 weeks to implement. So we thought that this was very much a high impact and a low effort. This is definitely a must-do project. Sorry, this ended up here. So finally, the last one was looking at increasing shifts. So 6 days a week manufacturing. It was only a half day on Saturday. And when you looked at the impact, it really had no additional batches. It improved some support, but it also created some more makeup and rework. So this really had a low effort, and it was also very expensive and took a long time. So that put you in the thankless task, and this project was eliminated from our improvement list. So that just shows you a few examples that demonstrate how to use the prioritization matrix to really have a more objective view on your improvements. Now I want to take you through some lessons learned and some things to watch out for when you're doing this effort. Talking a little bit more about the changes in market forecast. You really want to evaluate confidence and risk. Have a good understanding with the marketing team on where they expect the changes to happen within this forecasted demand. That gives you a better understanding of what things should be planned for ahead and what things that we know are pretty much set in stone. Another way to handle this is sometimes you can delay your decision by increasing improvements, and that can then delay the decision until you have a more concrete path forward on your market forecasts. I also talked about your boundaries on flexibility. You really want to understand what those objectives are and how you can plan in your flexibility. One example of that is planning spaces for changes. So you can have shelf space and you can have clean rooms with nothing in it. That gives you some flexibility that when you do know how you're proceeding, you still have some of that project already done, which can reduce some of your implementation time for those items. Another example is within filling the syringe and vial lines. What we're looking at right here is, in this example, they had a combo syringe and vial line at this point in time, which really gave them a lot of flexibility to be able to do both types of dosing. But once you get into demands up in this area, usually you can't use a combo line and you have to have dedicated vial and syringes lines. So it's important to understand which one is going to be more, or understand how much your product mixes are going to be in syringes and vials, so you can plan to know how many syringe lines you need and how many vial lines you need. And that's a good example of showing how these forecasted demands can sometimes impact your decisions at the time. For this specific project, they made the decision to go with vial lines, and later in the future, their syringe product had more of demand than their vial product, and then they were scrambling to put in a syringe line after the fact. The next one is making sure that you have realistic lead times. You need to understand cycle times. It's not just time to process, but how long does it take to clean and change over, and when you can have, and what else needs to be done before another batch can start. Often, the earlier product has to be fully out of that room, and that room it needs to be cleaned and changed over before a new product can happen. So it's really important to understand how you're going to operate. Even if it's only one product, you still need to do cleaning and changeover depending on dose concentrations and dose sizes. You're also usually not at 24 hours per day, so you also need to understand shift changes and when to stop for the day. So putting together a chart like this, we have a better understanding of the color codes really talk about a specific product and which room they're in, and when you're doing changeover, which is these black lines here. This really gives you a better understanding visually on how your products are moving throughout your facility. It's also important to understand full lead times, when it can be distributed, and storage requirements. So looking at this lead time, your processing for your product really is only a small fraction of the overall lead time of your product. When you add in raw materials, processing, finished goods staging, quality testing, and consumption. On this example, quality testing had to be sent out, and it took a full 2 weeks to be able to get your results back. That really means you have to be able to plan for those storage requirements, because you're making more product as you're waiting to send out your product that's already been made. All this work has been done analyzing the data and justifying the options. You really should use it to show your due diligence and build a business case for the project. Cost justification example, what we're looking at here is a cost justification example for the capital project of including a new, faster tablet press. You really want to put dollar values to the benefit of the investment. We're looking at throughput, labor, downtime, and other items. So in this example, they're looking at a new tablet press that will increase their throughput on 100 tablets per hour. And it also will increase equipment utilization. So being able to quantify that was an increase of about 430,000 doses per year, which translated to $345,000 per year. There also was a decrease of 2 operators. And I just want to note, this isn't always a decrease in operators. Sometimes it's just you would have expected an increase in 2 from the current state when you add another tablet press. It could also be reduced overtime, and there could also be shared operators. The decrease of 2 operators was a cost savings of $52,000 per year. For the maintenance side, we tracked work orders and subtracted man hours and components. That gave us a reduced cost of $38,000. There was also some additional cost of goods with the increased throughput. And this is things like utilities and components. And that was an increased expense of $12,000. When you add all this up, you could justify $425,000 per year for a capital investment of approximately $1.3 million. But you've justified it, and you also have an ROI of a little over 3 years. And this makes it, showing the information this way makes it a little bit easier of a pill to swallow when you're asking for money for your facility. So just in conclusion, I hope you've learned a few things to leverage the data collected and develop a process to interpret it. Spend time to strategically plan, Do this by understanding not only your current manufacturing capacities, but also your maximum capacity and how it relates to forecasted demands. It's also important to understand the risk and your expected changes to your future demands. Then you should leverage that analyzed data to make decisions and develop a scope and a business case for your capital projects. Any questions?
Kristina, thank you very much. I'm monitoring for questions here, and I'll start with some commentary that there was a great view of really a traditional approach for mining processes for improvements and innovations. Curious about the any aspect of technology that may have used in that work. Was there any part of it that was driven by certain technologies?
Well, I know a lot of it is, I try to spend a lot of time of how you can, using the technology, to try to get it into a format that you can easily analyze. If it's, a lot of times it's just data that's just sitting there and no one does anything with it. So there's a lot of things that can be added on the back end where you can pull the data and put it in a format that then you can see those control charts and you can see those cycle times automatically, and then you can look at it forever. You can look at it periodically, and it isn't this large project that has to happen every year where you're spending all of this time trying to look at the data. If it can happen easily, it makes it much easier to interpret it.
Very good. I think one of the things that you demonstrated very powerfully is that in a discussion where we have big data and advanced technologies to look at things, the often small data and with high quality can give you so much greater insight on what's actually going on when it comes to driving real improvements and innovations. How much of the work that you have done here was data that was automated and you investigated, or really was more like small data, where what I call by small data is that you had actually smaller sample sizes that you were observing and using to verify some of the actions that you needed to take?
I think a lot of this, because I'm a big proponent on where that data is already being collected and then getting a download of that and reviewing that analysis, we didn't do that much in terms of time studies or things like that where we were really in person watching that. There were things that we could do for like cycle times instead of time studies. In one of the particular cases for the tablet press, the room gets changed in status. So we know when it's in processing, we know when it's clean, we know when it's back to ready. We used that kind of data there, and those changes in statuses that's already being logged somewhere in the process automation system, that we could then use that as our cycle times and use that to understand where we're having some variances in cycle times. The one place that I wish people would do more of is batch records and throughput, because that really isn't being, even if it's electronic back records, I don't see that getting put in a repository anywhere. We kind of have to look at sometimes at SAP and where the receiving, what is being shipped out and the doses being shipped out, and kind of pulling it from other areas. It's not automatically collected. So I think it was a mix of data that's already being collected and then some work to try to figure out how to interpret it.
Love that, love that. As a matter of fact, William Fuller had a question just on this that you just answered, which is if your source of data came from ERP systems and the like, and you have just commented on that. Another question that came up, maybe from the more purest lean practitioners in attendance here, is that you highlighted that the bigger batch sizes were actually a form of improvement to accelerate cycle time, to reduce cycle time. Of course, that's just the opposite of Little's law and when it comes to lean processes. So talk a little bit more about how bigger batch sizes actually help reduce cycle time, because that was a little bit counterintuitive for a lot of in the audience.
So I don't know if that's just something that comes from pharmaceuticals and a regulated industry, But for every single batch, there's a number of samples, there's quality testing that has to happen, there's setup times and cleaning that has to happen between every single batch. And a lot of times, those areas are some of the highest wasted items, where there's a lot of ability to decrease cycle times.
Gotcha.
So if you can decrease some of those batch-based activities, by having a larger cycle time, by having a larger batch size, you can have some large impact within it. But then there's some negative sides of that you have to evaluate. So for example, you have to do a lot more picking. It takes longer to process it because you now have a larger batch size. There's limitations on your equipment sizes. So you can only go to a certain batch size. And even sometimes it is monitored by how big your batch sizes can be based on your regulatory filings with the FDA, or even on controlled substances, if we're talking about maybe DEA controlled substances. So you have to look at it from different areas, but I think within the pharmaceutical industry, there's a lot of waste around things that have to happen on a per batch basis.
Got you. That was very helpful. So it looks like you discovered this additional capacity, right, in the facility by doing several of these improvements. Curious, how things have progressed, not just in that facility, but maybe in other places that you work on, and specifically with the background of COVID-19 and the impact that it has had in many processes in the pharmaceutical industry. Curious about potential impacts that COVID has had in your business and in your operations.
Well, it's been super busy in the pharmaceutical industry. I don't know if we ever really slowed down. We're just trying to find ways to navigate things, even doing like FATs through video conferencing like this. Because we have to kind of continue. Some projects are too far along. Some projects are put on hold. And then there's a bunch of projects that are coming just based on COVID-19 and the race to get vaccines to market. What does happen is if you have done this capacity analysis, you can respond to this big change that no one knew was coming very quickly, because you know how much additional capacity you have in your facility. You know where you have areas for flexibility. You can kind of be the facility that says, hey, I have capacity, bring that vaccine to our facility. I mean, a lot of times, if we're talking about big pharma, the facilities are all competing against each other for some of those products and that capacity to help keep them at high utilization. So being able to respond quickly to having additional capacity, that's where we're seeing a lot of that reaction to COVID-19.
And how do you see the progression on your improvement and innovation efforts? Are you still seeing a need for improvements and efficiencies related to capacity, or is your attention when it comes to prioritizing opportunities for improvement and innovation, they're migrating elsewhere in other parts of the business? So what does the portfolio may look like today?
I think it all really depends on specific clients and what they have internally, and if they have taken on a continuous improvement environment or not. If there's an internal OpEx department, actually that helps me out a lot more, because they understand where I'm coming from, maybe collecting all that data already, and it makes it a little bit easier to do that. There's always the need to not only have additional capacity, but do a lot more for less money. You're always fighting for a piece of that capital project's budget yearly. And I see this as helping in twofold. One, it really helps to understand what you can do with the facility that you have now when you don't have those budgets. But also, if you can demonstrate that you really have a good understanding and have done your due diligence on how your facility works, and really show the justifications to all the money that you ask for, you become a very reliable facility within your organization, and they'll send you stuff. They'll send you extra products because they'll know you guys will find a way to get it done. So that's where I see a lot of the use of this.
Very good. And one final question. What do you think are the biggest lessons you have learned with the organization taking more of this strategic planning approach that you share with us? What, if you look back, what have been some of the key takeaways for you?
I think the key takeaway is that there's so much of a reasoning to be very reactive to changes in things. You find out, hey, we have to change, we have to put this new product in, or we have to do something like that, and you just automatically are like, okay, we need a capital project and we need to do it tomorrow, and you rush to get it done. If you really understand how your facility works, you already know when you get that information, you've already analyzed the different options and probably can respond proactively and say, okay, well, we thought about this and we know that we have to implement these set of projects for this case of a scenario. The other thing that I've learned a lot is, all of this stuff, you talk to the operators, they already know how to improve the areas. They kind of know what's going on, and once you start digging deeper, you understand that they just don't have, sometimes they don't have the means to make those improvements. So if I can be the facilitator that helps to get the funding and also get the correct management to understand what needs to change and fix those challenges, then that's very rewarding for me.
That's excellent. Kristina, thank you so much for taking the time to sharing this experience and journey with us. We very much appreciate that.
Thank you, Jose, and I also want to thank Proqis for the opportunity.
Thank you very much. All right, ladies and gentlemen, this concludes day 2 of Process Mining Live. So let's take a quick look at what we have in store for tomorrow. We're going to start the day with the leader for Celonis talking to us about achieving process excellence by combining artificial intelligence, process mining, and task mining. He's going to share with us some case studies related to the application of these combined technologies. Right after that, we will have Janice Minis, who is the Global Change Manager for Warner Media, discussing the impact of COVID-19 and in the application of process management in her environment, in what turns out to be a media organization. We're going to follow that up with the Vice President for UiPath in process mining, an expert in process mining, and he's going to talk to us to learn why process mining itself provides little value. Now, take a dose of that. We have the leader for process mining, one of the leading organizations in process mining, telling you how process mining itself provides little value. So you want to listen to that, and you want to understand why he's taking that position, because I think it's a very valuable position that he's going to share with us. And we're going to finalize tomorrow with Dr. Mark McGregor. And Dr. Mark McGregor is going to have a very interesting review of business processes, technologies, discussing mining, modeling, or management, where you should place your bet when it comes to creating the most value for your organization. A very interesting presentation as well. He takes perhaps some contrarian positions when it comes to certain items related to process development, business development, technology. Very interesting, very entertaining. I suggest that that you stick with us for tomorrow to wrap up the conference with Dr. Mark McGregor. Today we are completed. I hope you have a wonderful rest of your day, whatever you are in the world, your morning, afternoon, or evening. Enjoy the rest of your day, and I hope to see you tomorrow here at this channel early on. Thank you.